All right, hello and welcome to the abridged version of episode 2, Resident ENT, with me, Josh Dramiello. We're going to be talking about the levels of the neck. So just to recap a little bit, these are the cervical fascia layers. Outside we have the platysma, which is encased in the superficial cervical fascia. And just inside that, we have the superficial layer of the deep cervical fascia, notated in blue, which is going to encase the sternocleidomastoid muscles, the strap muscles, and the trapezius. And once we open up that area, all of this area amongst the visceral fascia, the carotid sheath, and the prevertebral fascia are going to be our fibrofatty packets that we're going to extract or excise or resect for our neck dissection. When we get looking at the levels of the neck, as a surgeon, we don't think about them in radiographic terms, but instead in surgical anatomy terms. And so we have a slightly different way of delineating the levels than a radiologist does. So we have some important structures notated here, and as we go through the levels, I'll tell you what they are. So this first red line is the anterior belly, followed by the posterior belly of the digastric as it goes up towards the mastoid. And anterior or medial to that is our first level. It's level 1A. It's technically not bilateral. There's just one level 1A. Posterior to the anterior belly of the digastric and to the posterior edge of the submandibular gland is going to be our level 1B. This is important because it hides a mylohyoid in that area. And it's going to be, its inferior cutoff is going to be the hyoid bone. Posterior to the posterior edge of the submandibular gland gets us into level 2A as we stay above our hyoid bone. But level 2 is actually going to be split into level 2A and 2B by cranial nerve 11, or the spinal accessory nerve. Below the hyoid bone, we have levels 3 and 4, which abut the posterior edge of the SCM, the sternocleidomastoid muscle. So the anterior border is going to be the lateral edge of the trachea. It's going to come up to the posterior edge of the SCM, and then the two layers are going to be split by the omohyoid. In fact, it's going to be the tendon of the omohyoid that delineates the two. And there we have 3 and 4. Posterior to the posterior edge of the SCM, and as we come up to the prevertebral fascia, or what's commonly known as the floor of the neck, is going to give us level 5. Now, not commonly used, or I should say excised or resected in selective neck dissections or modified radical neck dissections, is the level 6, which is the central neck compartment. And this is the area just overlying the trachea, pretracheal nodes. It also, there are some nodes underneath the thyroid gland, most notably known as the Delphian node. But that's more important for thyroid cancer. In the run-of-the-mill neck dissection for head and neck cancer, these are how surgeons delineate the levels to excise. So again, this was the abridged version. We have a slightly longer version up and running if you want some more detail. But otherwise, I hope this was helpful, and I hope you have a good day. This is Resident ENT. Thank you.